We are about to have a debate beginning in a few weeks on health care in this country. The first debate and any significance on the subject matter in more than 15 years. And one of the major features of that effort will be to deal with prevention, to really encourage it, to incentivize a process that says that the best way to treat a disease is to prevent it from happening in the first place. What better way to begin that debate and that discussion than with the adoption of this piece of legislation, which has been languishing for almost 10 years because of the inability of both chambers to be able to deal with this matter in the same year at the same time in the same Congress. This bill has been vetted and debated and debated and debated over and over again. And while Frank Lautenberg and Dick Durbin and Matt Myers and many others have been involved, there's not a person in this room who wouldn't disagree with the fact that the real champion of all of these on health care issues has been our colleague from Massachusetts, Ted Kennedy. And obviously he's not with us today. He's recovering and struggling with his own illness, but in his place, which is irreplaceable, I've been asked to sort of manage this legislation on his behalf. We spent last week or the week before the recess in our committee over 2 days in a markup of that legislation. I appreciate Mike Enzi's efforts to work with us. We ended up with a bill coming out of committee, and yesterday a cloture vote on this matter to demonstrate how important this issue is. The Family Smoking Prevention and Tobacco Control Act is a fight that many have been waging for a long time. And obviously the numbers and statistics say more than any rhetoric that I can offer. The fact that between 3,000 and 4,000 children today in the country will begin smoking. And every day that we delay in adopting this legislation, just keep that number in mind, that every single day we delay and wait, another 3,000 to 4,000 young people will begin smoking, a third of whom or more will end up becoming addicted to these products, addicted to the smoking tobacco products. And I stand in front of this podium today as someone who has been a smoker, and I can tell you how difficult it is to quit, and the addictive qualities are powerful here. So the idea that this is an easy matter for people once they become addicted to get rid of is difficult. And out of that 1,000 or so that become addicted, somewhere between 300 and 500 are going to die. I have around 76,000 of my kids in Connecticut who smoke today are going to die because of tobacco products. And those statistics in every state across the country. And of course, these numbers indicate how serious the problem is, because if you take all the other major causes of death in the country, whether it's from suicides or murders, illegal drug use, alcohol, all of these other matters, and combine them together, you don't end up with the number of statistics that smoking causes in 400,000 every year. It is a major, major public health issue, and it's self-inflicted. This is not a question where, because of genetics or other matters here, it's a self-inflicted wound in our country that costs us dearly financially. If you're not impressed by the ethical or moral questions involved here, it needs to be addressed. This bill is not going to solve every problem. It's not going to mean that everyone's going to stop smoking tomorrow or when this bill gets adopted, but it will allow us to make a major effort in this regard. And so and it's going to cause the industry itself to come up with a new business model, because as we know, to replace 400,000 smokers, you've got to appeal to a younger generation. 90% of smokers began in their early teenage or preteen years. And so that business model is going to have to change, and it will change the day this legislation is signed into law by the President of the United States. And we pray and hope that that will be the case. It'll require changes in how we manufacture, market, produce these products, what it prohibits in very strong legislation with strong penalties to be imposed. It prohibits outdoor advertising within 1,000 feet of schools, children. Advertising in publications with significant youth readership will have to be severely curtailed and limited. No pictures, mascots, eye-catching logos associated with these products. And lastly, tobacco product vending machines will be banned everywhere except in adult-only facilities. Parents do not deserve to live in fear that their children are going to be marketed with cigarettes when they're at school, reading a kid's magazine, eating a meal with a friend at a shopping center. And let me just say to those as well, I suspect, and I don't know this categorically, I just suspect this to be the case. For parents who are smokers, put aside the parents who are not smokers and what they would hope for their children. I'm willing to venture that almost 100% of parents who smoke, if they had any one wish today, one wish, it would be that their children would never, ever begin that habit, never begin it. And so for those across the country who are smokers today, if they could all stand here, many, I suggest, if not all, would suggest that we ought to do everything we can to prohibit young people from getting caught up into this problem of tobacco addiction. So I'm pleased to be standing in the place of my friend from Massachusetts, who has been this champion for so long.